Each day in the United States, more than 11 million people visit the emergency room, resulting in hospital admission. During these visits, patients want services that accurately address their needs and quickly improve their health. Advanced medical technologies and innovation in treatment techniques are critical to relieve small or even life-threatening symptoms. How does a team of healthcare professionals from Kaiser Permanente deliver fast and effective healthcare to patients in critical need of care?
Hi, I'm Carmen Adams. I'm the strategy leader for regional quality here at the regional offices for Kaiser Permanente in Northern California. In that role, I am lucky to head the clinical effectiveness team. This team of professionals actually works specifically on performance improvement projects that will enhance the outcomes for our patients at Kaiser Permanente. One of those projects that we're working on is sepsis. What is sepsis, you might ask yourself? Sepsis is actually an infection that is characterized by certain vital signs and characteristics that are the body's reaction to that infection.
Sepsis is a potentially deadly infection that causes your immune system to attack your body rather than protect it. It's a leading cause of death in U.S. hospitals.
We usually see sepsis patients as they come to us in our emergency department. These are patients who have an infection, and so we will see a high heart rate. They usually have a fever, or they may have an especially low temperature. They also can describe discomfort or pain, and it's usually associated with a wound or perhaps foul-smelling urine.
Because patients often develop sepsis before they get to the hospital, diagnosis and treatment during the initial golden hour time frame becomes critical. Yet most hospitals struggle with this. In fact, only half of patients with septic shock, the most severe form, get effective treatment within 6 hours of onset.
When we think of all the things we might improve for patients, why did we pick sepsis? What was it about it? Well, actually, we discovered that our mortality rate was higher than we felt was acceptable. And we're always interested in keeping our patients healthy. And so we got to work. We had to figure out a better way to manage these patients.
Using an existing protocol called early goal-directed therapy as a starting point, care teams of intensive care specialists, rapid response nurses, pharmacists, physicians, and emergency department personnel designed a protocol known as early goal-directed therapy. When a patient arrives showing symptoms associated with sepsis, aggressive treatments are initiated according to specific vital sign ranges, clinical conditions, and timeframes. Now physicians, specialists, and nurses have the ability to adjust treatments, not just within the critical golden hour window, but throughout the first 6 hours to treat patients.
So let's talk about one case that came to our emergency department. This is a 16-year-old Jose Guerrero, who's a soccer player, and he had injured his foot during one of the games. He came to our emergency department because he could no longer walk on the foot. He said, "I knew I had cut it. It was kind of red, it wasn't healing, but today I can't walk on it." Sure enough, when we did his vital signs, we discovered he had a high temperature, a high heart rate, and the actual appearance of the foot on the front is normal, and then you turned over the foot and discovered that it had already impacted even the tendons.
Here's your challenge. Help Kaiser determine the early identification of sepsis and the next steps for their patients' pain management. To solve this challenge, utilize the early goal-directed therapy algorithm driver diagram that describes early goal-directed therapy. Also, consider the following areas: SIRS criteria, observational data, and lab results and vital signs found in the sepsis challenge document.
When he came to our emergency department, the tech immediately discovered that he had a high temperature and he had a high heart rate. He already meets the criteria for 2 diagnostic features that require labs. So the lab tech draws the necessary lab work on him. We get those results back, and now we're moving left to right. In order to make the diagnosis, we're reliant on those lab results. If they come back positive, we're going to immediately move to treatment, appropriate treatment for him based on those.
With the help of the early goal-directed therapy, Kaiser healthcare professionals were able to categorize the patient's symptoms and react quickly. How does your solution compare to Kaiser's solution?
Now that you've had an opportunity to wrestle with Jose's case, think about his treatment and what might have been done, I should share with you that the team did exactly what they needed to do for this patient. He came to us in septic shock, he received the appropriate early goal-directed therapy, and as a result, did pretty well. Our work with early goal-directed therapy has taught us that you can actually intervene at a point in a patient's disease process and make a difference for them. The earlier we see the patient, the better the outcome. We're now in a position to share it with other organizations, nationally and internationally. So when you're thinking about staying healthy or what you might do for yourself, certainly being current with your immunizations, getting a yearly physical, encouraging family if they do have an infection to come in sooner rather than later.
By 2026, 4 million jobs will become available in the healthcare industry. Healthcare professionals help to promote well-being, prevent diseases, and deliver essential healthcare services to individuals, families, and communities. The fastest-growing sectors include healthcare support occupations and healthcare practitioners and technical occupations, which entail home health aides, physician assistants, and nurse practitioners, among other positions. The arrival of new technology and increased innovation like the early goal-directed therapy allows healthcare professionals to engage with more patients, help maintain their health, and save lives.
So how did we develop early goal-directed therapy protocol? We actually invited experts around the country to participate in our design. There are a lot of people behind the scenes who were involved in it as well. Largely, people think in terms of course, the physicians and nurses who are associated with this protocol. But it includes the lab tech. It includes everybody from that admission department, the person who first sees you when you come to the emergency department. We have nurses working in a variety of areas, not merely in the emergency department, but folks like myself working in quality, looking at the data, trying to get a better idea of what that means to the patient. We have several people in our IT department who are working for our computers. We have an electronic medical record and ensure that we are capturing the right information.
The professional skills used by the Kaiser team for this challenge included teamwork, data analysis, technology skills, critical thinking, and problem-solving skills. The healthcare industry includes hundreds of roles that require high school diplomas, college degrees, and just about every other level of education up through doctorate level.
Some of my favorite classes were in biology, statistics, general health, public health studies, and most recently I achieved my doctorate at Yale University. I know for myself I'm one of 13 children and the first to graduate from college. And certainly my parents were not in a position to pay for that schooling, and so it was up to me. I was able to go through on scholarship. It's all possible.
To pursue a career in the healthcare industry and join a team like the one featured today, consider taking advanced courses in biology, statistics, general health, public health studies, and technology. If you like solving challenges like this, consider careers like the ones offered at Kaiser Permanente: infection specialist, clinical registered nurse, IT engineer, data center IT support,